Dear friends, as much as the surgery was important, the post-operative instructions are also very important for your uneventful healing, and you must very diligently adhere to them. First and foremost, we would have given you a gauze pack in your mouth. Retain the gauze pack for 1 hour. After an hour, gently remove the gauze pack. Do not replace it. Have an ice cream of your favorite flavor, but it must not have fruits or nuts that can possibly get stuck there and lead to an infection. So it must be a plain ice cream, and then follow it up with 1 dose of your medications, both your painkillers and antibiotics, or as specifically prescribed and instructed to you. The second important instruction is to keep applying ice from outside. You'll have to keep ice up from outside intermittently. A couple of minutes on, a minute off, then a couple of minutes on, again off. Like that, you're gonna be doing it for half an hour each time, 5 times today and 5 times tomorrow, and then no more. Which means you're going to apply ice only today and tomorrow. How many times? 5 times. How long? 30 minutes each time. And how? Intermittently. Number 3, after getting home, you're not gonna lie down flat. You're gonna keep your head high position. If possible, keep moving about. You can be walking, you can be seated, but don't get to your bed. And if you have to get to your bed, have a couple of extra pillows so that your head always remains at a higher level than the regular. Alright, do you get my point? If you follow all these 3 instructions, taking your medications on time, after you remove the gauze pack and after you have your ice creams, number 2, ice application, number 3, keeping your head high, pain, bleeding and swelling, the 3 most common complications after this surgical procedure is kept at a bare minimum. Usually, pain and bleeding should subside in a day or 2. Swelling increases over the first 2-3 days, remains steady over the next 2-3 days, and then subsides over the next 2-3 days or next couple of days. For some of you, you could also have slight difficulty opening the mouth. This would be there for a week or 2 depending upon the kind of surgical procedure that you have just underwent. Now, coming to the second set of instructions that you would be following through the day and for possibly a couple of days. As far as your diet is concerned, you might be worried, what can I have today? Avoid anything and everything that's hot, hard or spicy. Your diet schedule, that means, will be restricted to something that's soft, cool and bland food. So I repeat, avoid hot, hard or spicy. So restrict yourself to soft, cool, bland diet such as juices, yogurts, soups, mashed potatoes, scrambled eggs, smoothies, jellies and gelatos, lot of ice creams, and have a good time with them. A bunch of instructions that I'm going to follow now. Those are, do not put your tongue there, do not suck there. The most important among all these instructions is do not spit out or use straw. Spitting out and usage of straw can increase or decrease or cause positive or negative pressure, and any of these pressure changes can be harmful. In fact, they can prevent healing or induce bleeding, neither of which are good for us. So, no spitting out or no usage of straw. The most difficult instruction in these days would be to talk as minimal as possible. Depending upon your surgery, it could range, if it's a simple extraction, between 2 to 3 days, while if it is a complex work that you have underwent, for a couple of days more. And for the next day, you have 3 sets of instructions. Number 1, you're not going to brush on the day of your surgery. And on the day of surgery, if you want to keep your mouth clean, just take cool plain water, gently swish it around in your mouth and bend down, mop it out because you cannot spit out. Okay? Then, as far as the next day is concerned, you can start brushing all over your mouth except the surgical site where you got yourself operated. Number 2 is, every time you have food, we do not want any food particle, any food debris getting stuck in the surgical area and leading to an infection. So how do you avoid that? How do you prevent that? You take half a cup of lukewarm water, add half a teaspoon of salt, prepare your own fresh saline and gently rinse about every time you have anything by the mouth. Say you had a cup of coffee, you have a cup of tea with milk, or you have yogurt, you have soup. Immediately afterwards, take half a cup of lukewarm water, add half teaspoon of salt and gently rinse it clean so that your mouth is maintained clean, healthy. And it helps in healing pretty quickly and reduces pain as well. One more thing, we might have prescribed you a mouthwash. And how do you use your mouthwash? Your mouthwash, you take half a cup of plain water, add 2 tablespoons of your mouthwash, that means you're diluting it, Gently rinse about in your mouth for 2 minutes, 2 times a day, and for 2 weeks. So you remember how many twos I spoke. 2 tablespoons, 2 minutes each time, twice a day, and for 2 weeks. That's how you must use your mouthwash. And now let me come to those of you who have underwent a sinus surgery. A special set of instructions are important for you. One, on the day of your sinus surgery and for the next 2 weeks, you're not gonna blow your nose inside or outside. Don't do like that. You must not be doing it. Do not blow your nose harshly inside or outside. Even if you have to sneeze or cough, ensure all the air passes through your mouth, not through your nose. Number 2 is the next day. You had 3 instructions previously for your surgery as far as your brushing, saline rinses and mouthwashes are concerned. One additional instruction for people who have underwent sinus surgery is the next day onwards, you must do steam inhalation. Cover your head or use a steamer that can help you inhale the steam gently. Do not blow your nose inside or outside harshly. Gently inhale the steam slowly for 10 minutes each time, 3 times a day for the 2 weeks after your surgery. This ensures that your airway is clean and clear and also helps in healing and eventually helps you in getting back normal quicker. Thank you so much.